Good evening, my lovely, and tonight I'm going to be doing a cranial nerve exam on you. Now, this is no ordinary cranial nerve. I'm going to be doing it in reverse order. So, without further ado, let's grab our gloves. These are medium. I am still awaiting some small gloves. They should be here in the next few days. For now, these are all I have, unfortunately. So, let's pop them on. All gloved up, let's pop our mask on too, for safety reasons. And without further ado, let's start with our cranial nerve exam. So, if you haven't done a cranial nerve exam before, then it is just a neurological test on all 12 of your cranial nerves, okay? Nothing to be afraid of. Absolutely no surgical equipment or anything. Just simple tests to help you relax. So, it's just tests of your head, neck, and the nerves. Connecting them all. Your eyes and stuff is fairly straightforward once you know what you're doing. So, to begin with, we're starting with cranial nerve test 12 tonight. So, cranial nerve 12 is a hypoglossal test, which is a tongue movement. This is a simple test. All I want you to do is stick your tongue out and give it a wiggle from side to side. So just like this. I can't do it very well. My tongue goes like all over the place. Just something along that lines. Okay, let me just get my torch out. Just wiggle that tongue. Excellent. Okay. Now, I've already completely forgotten to introduce myself and get your medical history. How terrible of me. My name's Dr. Carla. And you are? And your last name? Excellent. Now what about your date of birth? Perfect. Oh, your birth is very close to mine. Excellent. And any medical conditions, history, medications we should be aware of? That's what we like to hear. Any colds, flus, like that recently, anything? Excellent. Well, with no medical history, no nothing, I think we can quickly go through the medical screening and begin. So do you smoke, vape, use e-cigarettes? Nope. Do you drink alcohol? Frequently, regularly, rarely, occasionally? Okay, that's okay. Any use of drugs? Or any illegal substances? Nope. Perfect. And any chance you could be pregnant? No. Okay, that's fine. No medical devices fitted whatsoever. Okay. Alright, well, I think that's the end of our screening. So, I'm just going to quickly take a quick drink, if that's okay. Now, so your tongue can wiggle, as we are aware. that is all I need to know for that test. So moving backwards to cranial nerve test 11, which is the accessory test. So it's your shoulder and neck movements. So I'm going to put my mask up. Is it okay if I put some pressure on your shoulders? Okay, now I just want you to shrug them up and down for me. Excellent. Just push against my hands. Push your shoulders up if you can. Pressure. Wonderful. Okay, now I just want you to look from side to side just a couple times. Just that side and then that side. Excellent. Lovely head and neck muscles. That is just what we like to see. And lastly, I want you to look up to the roof and down as far as you can without straining anything. So up to the roof and down as far as you can. Wonderful. No pain, no nothing that I should be aware of. Wonderful. Perfect. Okay. Excellent. Right. Unfortunately, just don't have enough room on my desk. It's actually quite annoying. That's okay, never mind. Cranial nerve test 10. This is your vagus nerve, which is your voice essentially. So, I'm just going to grab my colour blindness book and I just want you to read a few of the numbers and pictures, and that's a simple test to test your voice. Although I've already heard your voice, it sounds amazing, but we just need to cover all bases legally. Right. Just don't have enough space, unfortunately. So, let's see if we can find an obvious one for you to read. Let's go for this one. Can you tell me what you see in this picture here? Just tell me what you see in this square. It doesn't have to be right or wrong. This isn't actually a colour blindness test. A tree. Well done, my darling. Let's find another one. What do you see in this picture? What animal do you see in this picture? Yes, a cockerel. And we'll do a number just to be sure. What number do you see here? What number do you see here? 3. Excellent. Okay. Well, that looks and sounds excellent to me. Perfection. So, moving on to cranial nerve 9, which is a glossopharyngeal, meaning your gag reflex and swallowing motions. So, I'm going to grab my pen torch and I just want you to open your mouth as wide as you can and say ah. Stick your tongue out and say ah. Wonderful. Okay. Now for gag reflex. So keep your mouth wide open and say ah. Just going to pop this down as far as we can. Don't worry, it's been cleaned, it is sterile. Open wide. Perfect. That's exactly what we were looking for. A little cough or a little hit, and that means you've got a good gag reflex. So no signs of any oral thrush, no geographical tongue. It's all, you've got a very healthy red tongue. So that is amazing. Now, I'm going to ask you to do one more thing for this test. Can you just swallow for me? But just double checking you don't have anything in your mouth, like gum or anything that you sneaked in. No, I thought so. I was just checking. Alright, go ahead and give a swallow, please. I'm just going to feel as you swallow. Excellent. Okay. Well, you're acing these tests so far. Yes, absolutely. Right. So, next, we're going to test your hearing. So, for that, I have a lovely tuning fork. And essentially what I'm going to do is just direct the tuning fork, and I'm going to put it at either side of your head, and this is just what we call the RINI test. So this is just seeing if any ear hears it more or less, so just identifying hearing loss. It's about bone conduction versus air conduction. It sounds quite complicated, I know, but to keep it simple, we're just testing your hearing. So to begin with, I'm going to strike it on this ear, if that's okay. And just tell me when you can no longer hear it. About there? Okay. On the other side. Excellent. Well, I would say your hearing is pretty good because I couldn't hear it before you could, so. Wonderful. Now, again, I'm going to get our tuning fork out. My handy dandy Allen key right here. And I'm just going to adjust it so the pitch is slightly different, so bear with me for just a moment whilst I loosen it up, and we'll put it down to say here, because it doesn't quite work as you want it to at the top, if you know what I mean. These Allen keys are so annoying sometimes. Sometimes you wonder who this Allen guy was. Right, there we go. Let's just test that quickly. I don't think it works very well with these on, I'm not gonna lie. So I'm going to try taking it off. Just taking it off, you know. Right, that's that off. So nice and long. Now, just going to put that in the middle of your forehead, okay? Just tell me when you can no longer hear it. Okay, I'm going to strike it again, but this time I want you to tell me if you can hear it the same in both ears, just a bit different, okay? Is that the same, different, or about the same in both ears? The same, okay. That's good news for you. we'll move on to cranial nerve test 7, which is facial expressions and taste. So, simply put, I just want to see how your face moves. So, give me a smile. Excellent. Give me a frown. Good, but make that back into a smile. Yeah. And puff out your cheeks. As wide as you can, puff them out. Excellent. And close your eyes as tight as possible. Wonderful. Okay, so any changes in your taste recently you've noticed? Okay. That's fine. Okay. So, cranial nerve test 5. So, I am just going to use my pen. And I've got to make a brush, and I'm just going to get you to simply close your eyes and tell me if it's the point of the closed pen or is it the makeup brush. Sounds easy enough. Okay, so close your eyes. Wonderful. Tell me if this is the pen or the makeup brush. Is it sharp or dull? Sharp. I feel like sharp is the wrong word, but look for dull or soft. So soft is the makeup brush, dull is the pen. It's okay. Is that dull or soft? Dull, okay. And again, on your nose, is that soft or dull? Wonderful. Now I'm going to put them both on your cheeks and tell me which is which. Excellent, yes. Okay. Now, I'm just going to take my makeup brush, keeping your eyes closed, and I want you to tell me which part of your face I'm touching, okay? Excellent. Very good, my dear. Looks like you know your stuff. Okay. So, going in again with the makeup brush, just tell me if it feels the same on both your cheeks. Can you feel it the same? You can. Excellent. Okay. Now, next I want you to open your eyes. And I'm just going to take my finger and get as close to your eyes as possible. See how long it takes you to blink. Wow, that's very close. Okay. Excellent. Great. So next is cranial nerve test 3, 4, and 6, which is the oculomotor, trochlear, and aptsense, which cranial nerve test is missed out because we have already completed that, okay? So I want to get both your eyes open, looking at me, and I just want to see how your eyes react to the light, okay? Simply that, the bright light, just keep looking at my nose, just testing both sides of your eyes. Okay. Now, this time I want you to cover one eye, and I'm going to do the same thing again. Just keep looking at my nose with your other eye. Just keep looking. Well done. You're doing excellent. Okay, and close the other one, and look at the other one. And use your other eye. Look at my nose again. Just checking your pupil constriction. Okay. Now, opening both your eyes, just follow my torch simply. Simply follow the torch. Just follow it with both your eyes simply. Excellent. Now, and cover one eye and follow the torch with your other again. And swap eyes and repeat. Just following the torch to the best of your abilities with your open eye. Okay, now I'm going to get my gloves and open both your eyes and just follow my fingers. Nice and slow. Follow them to the best of your ability. Okay. Now let's just go back to my color blindness book once more. Wasn't there for now. And just doing a quick color blindness check, so we'll find some difficult ones this time. Can you tell me what number this is, my lovely? If you can see anything in that book. You can see 7. Excellent. There is also a very hidden 8 there, very hidden, yes. Oh, what's about this? There's 2 numbers in here. Can you spot them? You can see a 6 and a 5. 5. Yes, yes, yes. Okay. Now, finally, moving on to cranial nerve test 2, which is the optic nerve, which is your sight. So, I've got quickly measure your pupils. Don't worry, this won't take too long. Excellent, okay. Now I have my handy dandy Snellen chart here. And all I want you to do is see what you see, okay? So, starting up here, what do you see on the top line? Excellent. Down here, what do you see here? Wonderful. And down here. Here. Wonderful. And going down the row. Tell me what you can see here, starting here. What about this one? This letter. And finally these 2. Wonderful. Now moving on a row. Anything in this row you can see? Okay, starting here. Yep. Excellent, excellent. Yep. And this one, if possible. No, you can't. Okay, that's fine. Well done. Right, so just quickly tell me how many fingers I'm holding up. 4. And again, how many fingers? 2. And what about now? 0. Okay, so I'm going to get you to cover one of your eyes, and all I want you to do is look at my nose and simply tell me when you can see my finger with the other one. It's going to come from the side. Just tell me when you see it. Perfect. And again, keeping the same eye open. Tell me when you see my other hand. Wonderful. And switch eyes and we'll repeat the test. Excellent. And again. Okay. Now, opening both your eyes, just tell me when you can no longer see my fingers, okay? Just tell me when you can no longer see them. Wonderful. Okay. Okay. Now I'm just going to another look in your eyes with my torch. So keep them both open. And just focus on my ear, please. Focus on my ear. And the other side, focus on this ear. Okay. Good. Well, your sense of sight is nothing to be sniffed at, okay? It's wonderful. Now, last test for today is the olfactory test, which is cranial nerve test 1, which is your sense of smell. So, you know what you're going to be doing. So, I'm just going to grab 2 individual scents. What do we call them again? Aromas, therapy smells, you know. Now, I want you to tell me what this smell is first, please. I'm just going to pop it under your nose. Smells lovely. Just tell me what that is. Okay, good guess, good guess. And close one nostril and smell again. Does it smell the same, different? The same, okay. And I'm going to come in with a different essential oil. And can you tell me what this one is? Just as nice as I remember it being. Right, can you tell me what that smell is? Spot on. And again, cover a nostril and smell again. Okay. Wonderful. Now, I'm going to take one at random, and I want you to guess which one it is just by the smell. Tell me which one that is. Is that smell 1 or smell 2? Smell 1 or smell 2? And indeed it was smell 1. Right. Well, they smell wonderful, don't they? Yes, they do, they do. Well, I believe you are very healthy. I've seen nothing that alarms me whatsoever about your cranial nerve exam. So, I have no reason to be alarmed, no reason to refer you on. So, you are free to go whenever you want to. My goodness, these gloves are sticky, you know. So, thank you for coming tonight. It's been lovely.